Have Dr. Florence Namisi, who is an infectious disease specialist, here to help us understand the areas that we'll be looking at as far as COVID-19 is concerned. Dr. Florence, good to see you in studio.
Thank you.
Well, you know, Dr. Florence, there's so much, demystifying we need to do as far as some of the myths that pertain COVID-19 are concerned. Of course, looking at how to handle masks and, of course, how to boost your immunity, especially after recovering, noting that we've had some few recovery cases as far as what the government has been telling us. And Dr. Florence, I want us to begin by looking at the use of masks. What is the proper use of masks? And I'd like to hear from you. When it comes to using masks, what's the proper way?
All right. Thank you so much for inviting me to your studios. And you know, it has rained out there. Yeah, but I'm glad I'm here somehow. Now, when it comes to the use of masks, I think a lot of us have made observations, and probably that's the reason you're asking. When you're walking around on the streets, you see people wearing masks, all sorts of manners. Mm-hmm. For a lot of people, they are wearing it on their chins. Others are covering the mouth only, while others are putting it on the proper way. But the proper way of putting on a mask is to ensure that it actually covers your nose and your mouth, because those are the two areas where we expect the droplets to get in, to gain access to your body. So a properly worn mask must cover the nose and also cover the mouth. So ideally you should breathe through the mask, not over the mask. Yeah, a lot of people also, when they are talking, they actually lower the mask to speak. Mm-hmm. So I don't know whether people are convinced that the sound cannot get out through the mask. I'm not so sure, but that's I've observed. When someone is about to speak, they actually lower the mask. So make sure the mask covers the nose and it also covers the mouth.
Well, you know, like what you've mentioned, the culture is now becoming that when someone is, you wear a mask when you're not talking,
yes,
but you remove it when you're talking.
Yes.
Maybe you can tell us, what's the risk, the major risk in removing your mask, especially when you're talking to someone in public?
Yes. So ideally there are two main risks. The first one is for you to remove the mask, it means you touch it. So you touch it with your hands and then you lower it. So if your hands were already infected, or your hands had any germs, or even just dust or dirt, then you contaminate your mask because you're touching the mask. Then the secondly is now you expose your face, and you're able, you expose your face, you expose your mouth, and you expose your nose. So the protection that the mask was giving you is therefore removed. And finally, you also, as you now speak, your droplets are now getting out. They're now in the air and they're able to access your audience or your listener. And so if someone is in close proximity with you, therefore you can also infect them in case you're infected. So it's not right to remove the mask.
Now, let us look at the effectiveness of masks. I know we've heard of different masks. We talk about the N95, which is seen to be a little bit more expensive. And, you know, various other masks we've seen, the surgical mask, and now the ones that people are actually doing, it's a sort of tailor-made kind of mask. You see some that are made of clothing, like, you know, kitenge, the Kenyan, the African, you know, fabric. What is the effectiveness of the various masks we are seeing people wearing at this time?
All right. I think what we've seen is masks are evolving. I think they are becoming fashionable. People are now designing them in all sorts of ways. And those are especially the fabric masks. Now, the effectiveness of the fabric mask cannot be established medically because it depends. I've seen all sorts of fabric masks, some made in a multi-layered fashion, others made with just a single layer. And again, the type of fabric is different. But I've also seen some fabric masks that are actually made into 3 layers with a filter inside, a filter in between, an absorbent layer inside, and then the fabric is put on the outside. So I think that would be more protective. Now, on the medical front, we have the 2 types of masks that we have in the medical field. That is the surgical mask That is the normal mask that we use in the hospitals or in a healthcare setup when you're doing surgeries, when you're attending to just the normal patients. And it's been shown to be protective against the normal germs that we go through, the bacteria and all that. And also it prevents you from transmitting the droplets. Now we have the special type of mask, which is called the N95 mask. It's also called a respirator. Now this particular one is used for highly infectious diseases. Traditionally we've used it when you're dealing with patients with TB, tuberculosis. And right now it's the one that is recommended for use, especially for high-risk areas in the hospital. So it tends to be reserved because, one, it's very expensive. So at the same time, it's not necessary to have it when you're just dealing with routine conditions. So it's reserved for those specialists, especially if you're doing procedures that generate what they call aerosols. So that is when it is recommended that you use an N95 mask.
All right.
Yeah.
What do you make of some of the masks that we have, the tailor-made ones that are made of African fabric?
Yes.
And you've talked about some have the 3 layers.
Yes.
But what happens, if you don't have the ones that have the 3 layers? What's the risk at that moment?
Okay, it is recommended that we use masks. All of us should use a mask, whatever it is, even a bandana, because if in the context of COVID-19, it's been shown that droplets are actually the main way of transmission. So if you cover your mouth with whatever fabric that you're using to cover your mouth, the first thing is that it traps any droplet that comes out. And that alone it protects the environment from getting contaminated with any droplets that you have. So it's recommended. If you can be able to get that cloth mask, then it's recommended you wear it. You don't necessarily have to have the multi-layered mask. But if you're getting into an environment where you think the risk of transmission of the virus is high, like in a hospital setup or in a crowded area, then it is recommended that you obtain a surgical mask, because that has been proven to work. I'm saying this because some of the fabric masks that we are seeing are really made of thin fabric, and the quality of that fabric cannot be ascertained. And therefore, and the masks are not tested. They're not taken through the testing that is done, like by Kenya Bureau of Standards, to be ascertained that it can prevent you from getting into contact with the virus. So if you're going into a setup where you think the risk is real, I would suggest that you use a recommended surgical mask.
All right.
Yeah.
So basically, listening to what you're saying, Dr. Florence, is that all the masks have some sense of, effectiveness, in the sense that they can still protect you.
Yes.
Okay. But now, I think the question has been, of course, for some, because you find people like to recycle masks. Not too long ago, we had a story that was doing rounds on social media of persons who are actually picking up masks from, the streets, going and washing them, and then giving them back to communities and selling them, even in some cases. How risky is that, reusing a mask that, someone disposed of, and then you went and washed it and then put it back on your face?
Yeah, that is really risky. Risky because you are not sure the person who used it, their level, whether they were contaminated or not, whether they were infected by by COVID-19 or not. You're not sure, and therefore, at the same time, you're not sure when it was washed. Much as we have said that coronavirus is, or rather the COVID-19, is susceptible to soap, to washing with soap. Again, we are not so sure the level of washing that was done on this mask. So it is not recommended at all for us to reuse masks. Even if it's your own, ideally, like if you walked into an area which is considered infected and you're using a surgical mask, it's recommended that after a certain number of hours, then you discard the mask and you get another one, because the mask is therefore deemed to be infected. If you're using the normal cloth mask, then one, you should not share. And after certain hours of use, like 6 hours, it's recommended that you use another one and you keep that one. And once you reach home or once you're in a place where you're able to wash it, then you wash it thoroughly with soap and water, and then you can just air dry it, and then you can use it. But that was your own, not one that was used by someone else. So we don't recommend that you reuse.
So you should at least change a mask after a minimum or a maximum of 6 hours. How many hours are we looking at?
Ideally, we should change masks. The surgical masks we should change after 6 hours. Yes.
How about the ones that are tailor-made with African fabric or whatever other kind of fabric?
Yes. Still, depending on your level of exposure, if you're sitting alone in a place which is not crowded, like here in your studio, and you have not been exposed to other people, you can use your mask for the whole day. But if you're walking around on the streets on a crowded area and you determine that there was a risk that you could have come into contact with droplets, then it's important that you remove your mask after 6 hours at most, because if the longer you stay with the mask, if the mask is infected, then you risk breathing in the contaminated particles and you can get infected. Yes.
And there's this speculation, maybe you can clarify for us the whole idea of prolonged use of masks or wearing, that someone can actually, maybe pass out or something like that, or oxygen levels go lower. I mean, what really is the truth as far as the prolonged use of masks is concerned?
Yeah. So this has actually been observed that there are certain masks, and especially the N95 mask that we are talking about. If you're wearing it, then you have to breathe through the mask. And that means that you're not breathing air freely like what we are used to. So for some people, there's usually reduced supply of oxygen to the lungs. Again, depending on how tight the mask is, on how thick the mask is, then the air may not be able to pass through freely. And so some people get low supply of oxygen to the lungs, and it has been observed that for some people, the lungs have even collapsed. Yeah. So, and it's for that reason that, especially for small children under the age of 2, it is not recommended for them to wear masks. Because when they start having problems with breathing, they will not be able to say. For adults, it is recommended that you wear a mask when you have the risk of transmission. But when you're just on your own, then you can remove the mask and breathe freely. Yeah, so usually you're able to determine when you're not able to breathe, when you're having reduced levels of supply of oxygen, you begin to feel that you're having a problem with your breathing, and you're able to remove your mask at that point.
Let's talk about the people who like to do some bit of jogging in the streets.
Yes.
And early in the morning, and they want to jog around the streets, and of course maybe you don't want to wear a mask because maybe you feel like you will fall short of breath. What do you what do you think about this particular concern? I know some people have raised it, saying, you know what, you can't expect me to be jogging in the streets and then wear my mask at the same time. I might actually pass out. I mean, what do you think about this concern?
I think that concern is valid because during exercise, your requirement for oxygen is higher than the normal times. You need to breathe in a bit faster. Your body is utilizing more oxygen. So if you are restricting that air getting into your lungs, then you get into a position where you begin to feel breathless. But at this point, what I would want to say is rather than us just stress on wearing masks, then we need to stress on the reason why we are wearing the mask. So they were wearing this mask to prevent us from getting infected or breathing in contaminated air. So as you're jogging, you're able to gauge your environment. If you're jogging on the street and you are just on your own, then you don't need to wear the mask because you're not infecting anyone and nobody is infecting you. Lately, I've been taking walks through Karura Forest, and I've been seeing a lot of people streaming in there. And sometimes when you're walking in the forest, you realize that along the stretch you are just on your own. And there's a lot of nice fresh air that is coming in through the forest. At that point, I remove the mask. I don't have to wear it because I'm not infecting anybody if I have the virus, and nobody is infecting me. But if I reach a place where there are people who is a crowd, at that point I wear the mask because you're not so sure if the air at that level is contaminated. So I think we need to concentrate more on educating people to know why they are wearing the mask, so that they are able to gauge their own level of risk wherever they are, and then they are able to know when to wear the mask and when not to wear the mask.
Well, Dr. Florence, let's move away from masks in terms of now, because you've talked about it's good to understand why you're wearing the mask and what it is for in particular. When you look at how COVID-19 affects the body organs, let's just begin by first understanding which are the organs that COVID-19 affects mainly in the body.
Okay. So COVID-19 okay, let me start with talking about coronavirus. You know, the word coronavirus has been used a lot since we encountered this disease called COVID-19. But coronaviruses are viruses that have always been here with us. The normal cold virus actually belongs to this group of viruses called coronaviruses. So the main area of body that they affect is the upper respiratory tract. The upper respiratory tract consists of the nose and the throat. So most of the time, what we call homa, you know, nikona homa, I have a cold. So that usually is, and the influenza virus is a coronavirus. Now this is just a more severe variant of the influenza virus, the COVID-19 virus. And it has been shown to cause a more severe disease which goes down into the lung. Yes, and so inflammation of the lung is called pneumonia. So COVID-19 has been shown to cause a form of pneumonia. Now, before I even go there, let me clarify that out of all the people who will get infected by COVID-19, 80% of them will develop an upper respiratory tract infection, which is mild. Upper respiratory means just a sore throat going upwards to the nose, which is quite mild. So it is in around 15% of this population that we see what we define as severe illness. And these are the people who get sick and require to be treated and therefore require close medical attention. And around 55% of these will progress to critical disease. These are the people who now probably need to be in ICU, need assisted breathing, and these are the people in whom death can result. Now, it is in these people, the 5%, that we see these organ failures or multi-organ involvement. And the first organ is the lung. Yeah, so when it gets a pneumonia, you get the lung involved, and therefore you can get what is called a lung collapse. So in that case, then the individual requires breathing, assisted breathing, which is basically ICU ventilator. And if this is not instituted, then death can occur. Then just next to the lungs is the heart. And the virus actually can directly affect the heart, or through the body response also can affect the heart. And so in people who had initially had a heart disease that was pre-existing, it has been shown to worsen. And then others have been shown who did not have heart disease then develop heart disease in the process of COVID-19. Another organ that has been shown is our normal, what we call the digestive tract. That is basically all the way from the mouth into the stomach going down. So people with COVID-19 have been shown to develop diarrhea, and some of them vomiting. And again, closely attached to the digestive tract is the liver. So they've also been shown to develop some form of hepatitis. That has been shown. That's not all. So sometimes you also see that people develop kidney disease, have been shown to develop kidney disease, and people with COVID-19 have been shown sometimes to require dialysis. Yes. Also, the doctors who treat the brain have also demonstrated that COVID-19 affects the brain. And therefore, at that point, some patients have been shown to come in with confusion, sometimes in coma. And
why? How is it that it's able to affect the brain?
Well, you know, when the virus first gets into your body, it's shown that it gets into your body through the nose and through the throat and the mouth. And therefore, it multiplies initially in the throat. But after that, it will gain access to the blood vessels, and it will get into your blood. Once it's in the blood, it's able to access any organ in the body. Yeah, because you remember, blood is circulating in the entire body. So the virus is able to gain access to almost any organ in the body, and that's how it will end up in the brain, it will end up in the lungs, in the heart, in the kidneys, and even in the blood vessels lower down. Yeah.
Is it true that it actually affects the toes? I've read that online. Please help us understand.
Okay.
Is it true?
You've probably read it. I've not seen it myself, but what I know is COVID-19 can affect your blood vessels, and it has been shown to cause clotting of blood. And if this clot were to occur in the blood vessels on the lower extremities, then your toes will definitely get affected. Because when those clots occur, they block the blood vessels, and especially the tiny blood vessels. So an organ which was being the blood was being supplied by that vessel then gets affected. So if that happens to be your toe, then it will get affected. But most of that effect is actually what is seen in the lung, and is actually been suggested as the main cause of death, because when it happens to the lung, then an individual's lung gets destroyed and they're not able to breathe.
So help us understand as well, many of the doctors seem to be focused on treating inflammatory reactions that are triggered by the virus, and of course the capacity to cause blood clots. Why is there so much focus on the treatment of inflammatory reactions?
Okay. With every disease, there's what the doctors call in medical term we call it pathogenesis, meaning how does this disease cause illness? How does it destroy the organs? What happens exactly? Yeah. So in COVID-19, it has been shown that once the virus gets into your body, then it triggers your body to react by forming certain chemicals. And these chemicals are meant to actually neutralize the virus. They are meant to get rid of the virus. These chemicals are called cytokines. Yeah? And these cytokines is, when there's production of cytokine, that is what we call an inflammatory reaction. Yeah, an inflammatory reaction, because this reaction is supposed to, these chemicals are supposed to come back and neutralize the virus. Now, unfortunately, the virus is not standing somewhere on the roadside. It's inside a cell in your body. So for these chemicals to get rid of it, to neutralize it, it means they have to destroy the cell. Yeah, it's like if you see a thief inside a house and you want to get rid of them, you burn down the house, isn't it? Yeah. In the process, you cause a lot of destruction. So if this is the lung tissue, and these biochemicals that are called cytokines come in, then they destroy the lung tissue. Yeah, in the process of trying to destroy the virus, the lung tissue gets destroyed in that process. And when your lung tissue is destroyed, then basically your body is destroyed. You die, so you can't breathe. The lung collapses and you're not able to breathe. So a lot of medical attention has been drawn to trying to stop inflammation. Yeah, try and prevent the cytokines from being produced, so that you are able to limit the destruction of tissue organs in the process of the body's reaction to the COVID, because this has been shown to be what is actually causing death. Yeah, destruction of body tissues by body's own response. Yeah, to the virus.
And as you talk to us about how why treating the inflammatory reactions is very vital at this moment, especially like you've mentioned, if the tissues die, then the person automatically will be going towards actually dying.
Yeah.
But out of curiosity, someone is tested and they are found to be positive for COVID-19. What exactly happens? The doctors, when you're taken to the hospital, when they're trying to save your life, what actually happens?
Okay, as we have said that not everyone who tests positive for COVID-19 is going to require a doctor. Actually, I've witnessed a few of my colleagues who have gotten infected in the line of duty progress from being positive to being negative without being sick at all, not even experiencing any symptoms. So these symptoms are occurring in a very small subset of the population that has been affected by the virus. So what the approach that doctors have taken is that when you are tested for COVID-19 and you test positive, then the doctor basically classifies you. So you can fall into one category of being asymptomatic, meaning you are positive but you're not sick. You can fall into the category of having mild illness, meaning you just have a sore throat, in which case what the doctor does is to manage that sore throat, what they call symptomatic management. We manage, if you have fever, we manage the fever. If you have a sore throat, we manage the sore throat. If you have difficulty in breathing, then in that case you require more attention, and therefore you are taken in and you're given assisted breathing. Assisted breathing can start by just being given a mask, but in the case where you are determining that a patient's lungs are now not working, they are not able to take in oxygen, they are not able to sustain, then that's a patient who needs ventilation, and that's the kind of a patient who has to be put on a ventilator and requires ICU care. So it's a continuum of care depending on the severity of the symptom that the patient has. Then of course, as we have mentioned, that other organs get affected in the process. So as the doctors are taking care of you, they are able to determine which of your organs are getting involved, and they give you care targeting those organs.
And you know, people are actually even afraid of just being tested. We've seen that in Old Town Mombasa and various parts of the country, people shying away from getting tested. Others are said to have been, you know, they're losing their lives right at their homes because they have declined to just come out and get tested and know their status. Tells you, of course, of the fact that people are very fearful. If you were to speak to Kenyans right now about COVID-19, to dispel their fears and, you know, make it understandable that it's a condition like any other. Of course, it has created a lot of fear. It may look like it's more severe than other viruses we've seen in the past or heard of. What would you say, Dr. Florence?
Thank you. Yeah, understandably so. We have talked so much about COVID-19. Before it came to our part of the world, we saw a lot of horror-like stories from the West, where people were dying en masse. There was a lot of death in emergency departments were being shown. And so it looked like if you get COVID, it's a death sentence. Yeah, but right now, as we have said, a lot of people who have tested positive for COVID do not even know that they're actually positive for COVID. And they actually progress from positive to being negative without being sick at all. Some of them get to know they are positive when they're already getting well. They had a mild flu-like illness. They somehow get tested and they're told that they're having COVID. Now, it's only a small set of the population that is getting this severe. As we've said, the death rate out of COVID is 2%. Yes. Of all the people who are going to catch COVID, those who are dying are around 2%. Yes. So again, the death rate is low, and the death rate is associated with risk. There are those patients who are seen to be at risk, and they have been identified. Those are over 60 years of age. Those who have some comorbidities and cardiovascular have been suggested, and because out of observations, we've seen those people who have diabetes, people who have heart disease, people who have existing kidney disease have been shown to be at higher risk of death. So these are the kind of people who I would suggest takes utmost care. But the rest of the population, I would go ahead and reassure people that this is a very highly infectious virus. Now, when we say highly infectious, does not mean it is lethal. You know, infectivity of a virus is just how easily is the virus passed on from one person to another. It is so easily passed on. It goes on and that's why it's coming like a wind. It's like a wave. So it looks like in the end we might all just get COVID. Yes. Yeah, that's what it looks like. Yeah?
Okay.
Yeah, but how many of us will die? It just depends on the state of your immunity. And we have seen that a lot of people are getting COVID, and they're actually getting from positive to negative without being really that.
And some even who were in a severe situation are also recovering.
And some who are in severe situation are also recovering.
Well, Dr. Florence, I want us to take a break. When we come back, we talk a little bit more about COVID-19, of course, talking about recovery cases. We've heard of them in the country. The government has talked about them. And when we return, indeed, that's what we're going to be looking at, of course, with many other issues as far as COVID-19 is concerned. So don't go too far. And indeed, by the way, if you have a question for Dr. Florence, she is willing to answer your questions. You can send in your questions through our social media platforms, that is TV47KE on Instagram, Twitter, and Facebook. And of course, also, you can send in your messages through our SMS line on your screen. And of course, as well, you can call in and be a part of this discussion. Don't go too far. The Morning Cafe COVID-360 will be back shortly. Welcome back. If you just joined us, this is the Morning Cafe, and today, as always, we began this new segment where we talk about all matters COVID-19. Of course, we do know that, we don't know when COVID-19 will leave us, so it's better for us to actually take that time and understand all matters COVID-19, and of course, help us make informed decisions towards protecting ourselves and others. And we do have a guest in studio. She's called Dr. Florence Namisi, who is an infectious diseases specialist, talking to us about all matters COVID-19. I'm so happy to have you, Dr. Florence. Some of the things you've been talking to us about this morning, I mean, if you were not here, we'd probably still be very misinformed. But being able to get the right information from you is very important. And before we took a break, we were talking about recovering. You were telling us that, suspicions are everyone might actually get COVID in the end. But like you mentioned, COVID-19 is not a death sentence. We need to change that perception. So right now, let's talk about how to boost immunity after recovering. We do know that there has been a number of recovery cases reported by the government as far as the impact on COVID-19 in the country is concerned, and people who are tested positive and, having to go through certain procedures to their journey of recovery. But when you look at boosting immunity after recovering, we look at before, but boosting immunity after recovering, what's the first area that we need to look at that's the most important?
Okay. I think in all viral diseases, including COVID-19, our immunity, the status of our immune system actually determines the cause of the disease and largely the outcome of the disease. So you find that most of the viral diseases, as we have been told, do not have any medication that will get rid of the virus. Our body actually fights and gets rid of the virus. So it depends on the status of our immune system. And so it's very important that we look at how well to boost our immunity. Now, there's no magic bullet on how to boost our immunity, just the normal basics that we know about keeping our immune system boosted. Is the first thing is diet. Yeah, so a diet which is rich in fruits and vegetables is key. So we must eat a balanced diet, but especially fruits and vegetables we need to include in our diet. Exercise has been shown to be a very good immune booster, so we must keep our bodies exercised. Depending on your age, depending on your weight, depending on your any infections any conditions, health conditions that you might have, there are always appropriate exercises for you that you can do. The other thing that we need to do, and although maybe not in the short term, but in the long run, is always keeping our weight in check. Yeah, so a weight that is appropriate for your height is important for your immune system. So ideally, we should look at our weight, probably a long-term setup. Other issues that have been shown to improve our immunity is cessation of certain habits like smoking. Reducing alcohol intake has been shown to boost our immunity. And just things like having adequate rest and adequate sleep has also been shown to have a very positive impact on immunity. Yeah.
You mentioned that, of course, we do know that for some people, their bodies are able to fight the virus.
Yes.
And even as we'll come back to the diet, but how is it that the body is able to fight the virus? Especially looking at the impact it's had on some people, some people's body organs, like we mentioned earlier on, and then we see there are some people who the virus, their bodies are able to fight off the virus. I mean, tell us, how is that possible?
Well, our bodies are always fighting organisms that enter. These are what we call the infectious agents. In the environments where we live, we are exposed every day to bacteria, to viruses, to fungi, and to all other infectious organisms that are around us. And we don't always take medications for this because our body is always in a state of what they call immune surveillance. Yeah, there are cells in our body that are specifically meant for fighting infectious agents that enter our body. So in certain people, just this normal body response system is enough to contain the virus without you I'll give you an example. We always have colds. Yeah, a cold, the cold virus, we always get colds under normal circumstances, and most of us don't take any medication for the cold. What we do is we just take some water and we just take some rest, and then the cold clears. So how does it clear? The body actually fights the cold virus and contains the cold virus. So it is only in those whom either the response of the body is overwhelming or the effect of the virus is overwhelming. Yeah, that those are the people who get very sick. Otherwise, a majority of the population who are healthy are actually able to contain the virus.
Let's talk about the asymptomatic cases.
Yes.
When we even talk about asymptomatic cases, what do we mean?
So asymptomatic case means you are infected by the virus, which means if you are tested, the virus will be found in your body. But you're not sick, you don't feel anything. You're actually feeling well. You're going about your business like nothing is happening. So it's basically what is lack of symptoms. You don't have any symptoms that relates to the disease, and yet you have the virus in your system, so you're called asymptomatic. Yeah.
So when we talk about asymptomatic cases, or basically people who are showing no symptoms, how is this possible in helping us understand the workings of the virus in the body, and it being that there are some people who test positive for the virus, but yet there are no symptoms?
Yes. Well, as we have said, what do we call symptoms? What we call symptoms are what the patient feels as a result of the impact of this disease or of this virus on certain organs of the body. For instance, remember we said that once the virus enters your body, then there is production of certain chemicals meant to neutralize that virus. Now, in the process of formation of these chemicals, as they fight with the virus, the body temperature can rise. Yes? So when the body temperature rises above a certain level, then you get fever. But for certain people, that fight between these chemicals and the virus does not result in fever, which means your body is able to balance, and therefore you don't get to that point of fever. So you don't get the symptom of fever. Doesn't mean your body was not fighting the virus, but you just did not get to the point of fever. So the response of your body did not get to that level of giving you symptoms. Yeah, and this happens in a lot of people. That actually what asymptomatic just means absence of symptoms, you know. Yeah, so ideally your body is fighting the virus, and this happens all the time to our bodies. Our bodies are always fighting something. There's always something in our body. So by the time we begin to experience symptoms, it just means our bodies are beginning to get overwhelmed by whatever infectious agent is entering our body. Otherwise, on our day-to-day, on the routine activities that we do, we encounter a lot of infectious agents. And our bodies get rid of these agents without even us realizing that we actually got into contact with these agents. And this is also true for COVID-19. Yes.
And you know, we've had the government talking about this a lot. For some people, you know, the government saying that if you at all suspect that you are developing symptoms of COVID, it is good to isolate and, you know, observe your health for a couple of days. For this particular situation, what is someone supposed to be doing in terms of observing your symptoms or the faring on of your health? What are we expected to do when we are self-isolating?
Yeah. So first of all, we are assuming that you know what the symptoms are. So when you see these symptoms, you begin to suspect that you're having COVID-19. But then again, COVID-19 symptoms are not very specific. They are the kind of symptoms you develop with any other illness like malaria or even just a common cold. So you can have fever, you can have a sore throat, you can have chest pain, you can have joint aches and all that. So the best way is actually, if you see some of the symptoms, the best thing is to get tested. So, and the reason why it's important to get tested is so that if you are positive, remember we have said this virus is highly infectious. So you might fall in the category of people who will develop mild symptoms and recover. But in the process, if you go about your business as usual, you may infect someone else who is at risk of developing severe or even critical symptoms. So the key is to take care of yourself as you also prevent yourself from infecting others. So if you suspect that you have COVID-19 or you have developed symptoms that are consistent with COVID-19, my take would be that you obtain the test, and if that test shows that you're positive, then you will either self-isolate, which means now you put a barrier or a distance between you and the rest of the population. And this, as we have seen, the government is having a two-pronged approach. You can do it at home or you can do it in an isolation facility. And the whole idea here is to prevent you from infecting someone else. Now, when you're in self-isolation, ideally, you're supposed to, we are assuming that you are aware of the symptoms of COVID-19 and of progression of those symptoms. Of course, if this is an elderly person and a person who needs care, then it's a bit different, and this is the kind of a person who needs to be isolated in a facility where someone else can do that observation for them. So this person is able to know, the idea is to know whether this person is recovering or progressing, because certain interventions need to be instituted early to prevent progression from moderate to severe and to critical disease. It has actually been demonstrated that early intervention, like when the organs begin to get involved, early intervention is able to reverse those changes that can lead to critical disease and therefore lead to death. So that observation is key. And that's why sometimes isolation in a healthcare facility is better, because you have a healthcare provider who will be able to observe you. If you are at home, then somebody who is trained must be there to be able to observe and report, so that you are monitored closely and it is established whether your symptoms are progressing or whether you are on your road to recovery.
Dr. Florence, I know of a person who started developing what looked like a cough, coughing a little bit, and assuming, you know what, this is just a cough, it will go.
Yeah.
And eventually this person collapses and is rushed to hospital. Upon being rushed to hospital, is found to be positive for COVID-19. What are the symptoms we need to look out for as far as COVID-19 is concerned?
All right. Well, COVID-19 has come in many phases, what we call presentation. It comes in many phases. The most common presentation of COVID-19 is respiratory symptoms. Those are symptoms that involve the airway. The cough, the sore throat, usually they say the dry cough, and then a sore throat, and fever. So those have been the most common symptoms, especially fever has been reported in almost around 70 to 80% of the patients, of the people who have COVID-19. And then the dry cough. For some people, they just feel they have a sore throat. Yeah, and then now for others have these presentations that are not very common. Like some people have actually had the first thing they've experienced was just diarrhea and vomiting. And they didn't even have a cough, they didn't have fever. And when they were checked, they were found to have COVID-19. Some people present with general body aches. They feel like what we say we have malaria, you know. So someone is just presenting with general body aches. Others do not present with anything at all, as we have said. They are completely devoid of symptoms, while others present with sudden onset respiratory distress, which means sudden onset difficulty in breathing, where one did not have any difficulty in breathing at all. So it's a whole spectrum of presentation that has been seen in COVID-19. It doesn't seem to follow any pattern. Yeah, but yeah.
So looking at now, because we've actually looked at boosting the immunity of a person, I'd like us to look further into the diet, just understanding, because I know we've talked a bit about it, but it is good to also understand what kind of diet are we looking at. For someone who are tested positive, they have recovered, what is the best diet for them in terms of keeping their immunity strong?
All right. So the best diet for them is a diet which is actually best for everyone who needs their immunity up, and a diet which is rich in vegetables and fruits has been suggested because of the vitamins that it gives. So this is the diet that is suggested for most people. Just make sure that your diet is rich in vegetables and fruits. Yeah, so
all right.
Even as you take a balanced diet, but fruits and vegetables are key.
They're very key.
Yeah.
So let's take a look. Even as we talk about fruits, there's been a concern for some, just asking the question, how am I supposed to handle myself? Because I was talking to a colleague yesterday about our topic today, and she was telling me, you can never be too careful. You touch a doorknob, you might actually get COVID. Now you have to go to supermarkets, you have to buy bread, you have to buy groceries. So how careful can you be? So when it comes to handling groceries, let's begin there. How do you handle your groceries?
Mm-hmm. Okay, I agree with her that you can never be too careful. One, because infectious agents are everywhere. They are in the air, they are on surfaces. These measures that we are putting in place right now, like frequent hand washing, sanitizing, and the social distancing that we are putting, is just to minimize the risk, but we cannot eliminate the risk. The risk is always there that we will somehow get in touch with an infectious organism. Now, when you go to the grocery, for instance, you have no control over how many people have handled whatever you are handling. Mm-hmm. If you go and get a bunch of vegetables or a bunch of fruits, I've seen oranges where somebody is selling oranges and you go and touch almost all of them, and return and take another one and return. So you have really no control. But for those, the ones that you have picked and you have decided to go home with, yes, ideally when you take them, you should just wash them thoroughly. If it's a piece of orange, if it's an apple and you want to eat it, the issue is to wash it. And for this COVID era, of course, for an orange you will peel it. So you will eat the orange from inside, and therefore you assume that the inside of the orange has not been touched, and therefore it is safe for you to eat. For an apple, you can still peel, get the outer peel. For vegetables, you will cook. Viruses will not be able to survive cooking. Much as you will wash, and therefore you will cook. And so the idea is just the normal routine practices of how we are handling. So it's not necessary to go into details of washing. I think some people say you wash with vinegar and you wash with... you'll end up destroying some of the nutrients that you actually need in those. So just handle them the normal way. Just observe your own normal hygiene. And you'll reduce your risk. But the thing is, as a normal individual walking around in an environment, you cannot eliminate the risk of getting in touch with the infectious organism. So you also have to trust your body. I think the other thing I would probably like to caution against is the issue of stress and anxiety. Because a lot of people are now going to calm down because of stress and anxiety. You're just too careful. You're just too stressed about... I once watched a clip of a guy who was sanitizing his hands, and then he realized that the sanitizer, he needed to sanitize the container of the sanitizer because, I'm guilty
of that, by the way.
So I mean, it's the stress, and stress can lower your immunity. You understand?
I think we've come to a level of paranoia, Dr. Florence. Because
So
I will tell you, when I touch my phone, I'm from opening the gate at home.
Yes.
I'll have to sanitize my hands, and then I sanitize my phone.
Yes.
I mean, like we're saying, how careful can you be?
So, I mean, let's be careful in moderation. Let's observe what has been said. Social distancing, hand washing frequently. We put on our masks. But then again, let's also understand that the environment is not sterile. Yes.
Let's just to go back to groceries. I know for some there's been that question of, should I wash my groceries with detergents or with soap? Is that really safe?
No. That's not recommended at all. If you're washing your vegetables, just wash your vegetables with water. Do not wash your vegetables you can't wash your vegetables with soap. Some of these things people are doing are going to destroy the nutrients that you require from these vegetables. So let's just prepare our vegetables the standard way. Before you handle vegetables, wash your hands, and then just handle your vegetables the normal way.
All right. I know that was a very critical question because not too long ago, I was reading a story of someone asking about groceries. Of course, like you mentioned, you can never be too careful. You walk into a supermarket, you don't know who was there. But in terms of sanitizing your hands, let's now understand the whole idea of why you have to wash your hands and what impact it has on killing the virus or dealing with the virus. Let's first begin with the sanitizer.
All right.
And we'll also look at the fact that people have said that there are fake sanitizers out there. So even before we understand how the workings of the sanitizer on the hands or whichever surface it's poured on, which one is the safest type of sanitizer? What are you supposed to look out for?
Okay. I don't think I would be able to say what is the safest type of sanitizer. One, because there are so many brands of sanitizers in the market. Actually remember when this COVID thing started, there's a young man who told me that his friend has left his job, what he used to do as a boda rider, and he is now manufacturing sanitizers and selling. So he basically just went and bought spirit, surgical spirit and glycerin and started mixing and bottling them and selling sanitizer. Now they have said, it's been said that for a sanitizer to be effective, the alcohol content needs to be at least 70%. Now, for you and I who are consumers buying sanitizers off the shelf, how will you know that this sanitizer is containing 70% alcohol? It's very difficult because you can't test, you don't know. If it's written on the label that it contains 70% alcohol, then the best you can do is believe that it contains 70% alcohol. So really it's hard for us. And that's why we tend to just hope that if it has the mark of Kenya National Bureau of Standards, then it has been tested and it has been found to be effective and it's supposed to be there. But let's also not forget that even the counterfeits have the mark. Yeah, there are people who are able to get those marks and put them on those containers and just when you buy it, so it's very difficult. But having said that, the most effective way of keeping your hands clean is just washing your hands with soap and water. It's the most effective way. The soap actually dissolves the viral coat if there's a virus and bacteria on your on your hands. So you just apply soap and water, wash your hands. Rub your hands for follow the steps of hand washing, which I think have been described, around 7 steps, and then rinse the hand with water. That hand is just clean. So, and you find that soap is cheaper than sanitizer. So ideally, sanitizer, you can carry it and use it in a place where you're not able to access soap and water. But if you're able to access soap and water, then that should be your first line protection. Just wash your hands with soap and water. Otherwise, how effective sanitizer is, what is the most safest sanitizer, it's very hard because right now everybody is manufacturing sanitizer. And you don't know the ones that have been manufactured back door, like this young man who left his job as a boda rider to now manufacture sanitizers. He was doing it in his room, yeah? And you don't know how much of if the surgical spirit is more expensive, then he has to put little of it and give more glycerin. And therefore, I don't think that kind of sanitizer would be effective at all. Yeah.
Dr. Florence, what's the significance of using water and soap in terms of making sure that your hands are clean and you've been able to eliminate the virus? How does water and soap affect the lifeline, if I can say, of the virus?
Okay, a virus, the structure of a virus is that a virus is a very tiny particle, very, very tiny, and then it is surrounded by a coat. It's a small particle surrounded by a coat. Yeah, now it needs that coat to be infectious. So what the soap does is the soap dissolves the coat of the virus. So once the coat of the virus is dissolved, then the virus is rendered inactive. So when you apply soap to your hands and you rub, you are able to dissolve the coat of the virus. And then when you wash your hands with water, then it rinses off the virus from your hands. So your hands are clean and devoid of the virus. So it's very important. Soap and water is very important. So when you wash with, say, water alone, then the water alone is not able to dislodge the virus. But once you put soap, soap is able to dislodge the virus.
Yeah.
Yes,
Well,
from your hands. So it's very important to wash hands with soap and water in this time, and do it frequently, because you don't know at what point you have come in contact with the virus.
And how much pressure should you apply? Because for some, you find someone just does some bit of worship quickly and goes. Or if you're sanitizing, you just do it lightly. You know, is pressure significant in terms of eliminating the virus from whatever surface that you're trying to eliminate the virus from?
Well, ideally, the way we wash our hands normally, just the normal rubbing of the hands. You don't need to apply very high pressure. Just the normal rubbing of the hands. It's been suggested that you should at least take 20 seconds when you're washing your hands. That will give you adequate time for the soap to attach to the virus, to dissolve the coat of the virus, and also for you to address different surfaces. You know, you're supposed to wash the back of the hands, wash the tip of the hands. So sometimes, you know, we just apply soap, just touch a bit of soap and water. We do it more like a ritual, but we are supposed to do it systematically, so that by the time we finish washing our hands, all the surfaces, including the interdigits, have been washed, and the tips of the hands.
Okay. Well, thank you so much, Dr. Florence, for making time for us today. Of course, we have learned quite a bit. I like what you said earlier on, that COVID-19 is not a death sentence, because if you imagine the number of people out there who have not been very forthcoming in terms of getting tested, I mean, it's raising eyebrows, and it's a great concern for the government. But before we go, Dr. Florence, speaking to the Kenyans who are listening to us right now, what will be your final sentiments as far as COVID-19 is concerned?
All right. So my final sentiment is that COVID-19 as a virus is here with us. Most likely in the end we might all just get COVID-19. So my take would be that if you feel that you have symptoms of COVID-19, it would be important that you report to a health facility and get tested. But testing positive does not necessarily mean that you're going to die of COVID. The idea is just that you prevent infecting others who might be at risk of severe disease or even death. So for me, I think try and be safe. Wash your hands, as has been suggested, with soap and water. Put on a mask if you are in a place which is risky, and just generally take care of yourself and take care of your environment. The other thing that I've observed is, of course, there's too much anxiety. People think that once one has recovered from COVID, they can still get COVID from that person. The truth is that once one has recovered from COVID, they even end up testing negative. So they don't have the virus in their bodies. So you don't have to avoid them. You don't have to stigmatize them. A lot of people are being stigmatized because they got COVID. We can all get COVID, and we will actually, almost all of us will get COVID. So no need to stigmatize somebody just because they got And Dr.
COVID. Florence, before you go too far, I know that was actually a question I needed to ask. The whole idea, I mean, people say and speculate that once you've tested positive and you've had the virus in your body, some reports say that the virus can be eliminated from your body, and others say that the virus remains in your body. So what is true?
Okay, the virus gets eliminated from your body. Once the body once you've been through the disease, your body is able to get rid of this virus at some point. And a lot of people end up testing negative. Yeah. In fact, I think what the government of Kenya has been adopting lately is you must test negative before you are discharged. Now, when you're negative, you're negative. There's no virus in your body at that point. Yes. So it means the virus has completely cleared from your system and you're now virus free. Now the question is you can't get reinfected. So the fact that you have no virus today doesn't mean that if you get in touch with the virus tomorrow you can't get it again. So you can still get reinfected. So that issue of people have been talking about immunity. How immune are you after being infected? The truth is it's been documented, especially in those countries who have experienced this longer than us, that there are certain people who have been cured and then got reinfected by the virus. So when you get out there, you must continue taking precautions just like everyone else.
All right. Thank you so much, Dr. Florence Namisi, for your time. Such a great wealth of knowledge as far as COVID-19